hepatitis C for about 30 years. I did 3 treatments for the hepatitis C, but unfortunately, I was diagnosed with liver cancer. I was at home and I had that call phone, nobody wants. We found a tumor on your liver. When the doctor says that, the world just disappeared for me. For a few seconds, I frozen. I just thought, this is the end.
It's always a very difficult time when patients and their families first get to hear that they've got a cancer. And we have to be very conscious about that when we're discussing the options for them as to what they're ready to hear and when. We're absolutely frank about what we can offer, and I want to reassure the patient that when we discuss the various options, we try and find the most appropriate one with them. In terms of what I would advise patients is, this is a really brave new world in terms of therapies for liver cancer, and actually we've got more options available now than ever. And I actually would say it's absolutely okay to ask, is there a clinical trial which I'd be suitable for?
There is always a solution. I think each case is one case. In my case, I can tell you, I've been 9 days in the hospital. After 9 days, I gone home. After 3 months, I was working, and my life is completely normal.
Liver cancer is something that's obviously increasing because there's more patients developing cirrhosis, but also we're seeing patients who don't have cirrhosis, so who have fatty liver, also developing cancers.
Once the diagnosis is made, and of course that will be discussed in a multidisciplinary forum, and then a decision will be made in terms of the treatment itself, and some will go along with the what we call curative treatment, which will be liver transplantation or resection. Some will be palliative treatment to keep them comfortable, but majority of them will fall in between.
In terms of transplantation, there's a very strict criteria for the size and number of tumours you can have. And historically, it was very strict. If you were outside of that criteria, you couldn't have a transplant. But now we know that some patients respond very well to some of the treatment we give, so blocking the blood supply or burning or even tablet therapy. So we can take a patient who initially wouldn't be for transplant based on their criteria, but if they respond well to treatment, we can then get them back within criteria and then transplant them. So that's called downstaging. So that's been a big development.
A lot of patients live a long distance away from the hospital that will be treating their liver cancer as well. So sometimes trying to get transport to hospitals can be difficult. But it's just really important to remember that if there's any sort of obstacles that are in the way, that these can actually be sorted out.
If you Google things, you have a whole conflict of different information. Some of it correct, a lot of it incorrect, some of it frightening when it need not be. And so it is, I think, very important to talk to professionals and to societies such as the British Liver Trust, who are experts in the field, rather than just Googling.
From the moment I was diagnosed with having a tumour, my life changed completely, and so did my family's. They treated me with a procedure called TAE, trans-arterial embolisation. And if I hadn't had that support from the whole team, I don't think I would be here now, definitely not. They were there thinking of me and thinking of my best self. I mean, I can just say thank you for my life. That's all I can say to you.